Good morning, ma'am. I am Perlini Pabroques and I'm going to perform the procedure in changing solution and tubing. So for the assessment, gather all equipment and bring to bedside. Check IV solution and medication additives with physician's order. The materials needed for changing of solution is IV solution as ordered by physician. And for changing of tubing, we have the administration set, serial gauze, tape or label, IV tubing, sterile dressing and antiseptic, disposable clean gloves, and solution or ointment according to agency or recommendation of the agency. So for the implementation, we need to explain procedure to the client. So magandang umaga po, ma'am. Ako po si Perlin Pabroques, isang student nurse. May I know your name, ma'am?
Marie Chris Gomez.
So magandang umaga, Miss Marquis. So ngayon po, ma'am, kailangan po natin i-change yung solution nyo or yung IV fluid nyo dahil according po sa inyong doktor ay kailangan pa po ito i-continue. So next is to wash your hands to avoid passing of microorganisms from one another. So to change IV solution, we need to carefully remove protective cover from the new solution container and expose the entry side. Then, close clamp for tubing. And then, leave container of IV pole and invert it. Quickly remove the spike from the old IV container, being careful not to contaminate it. Then, steady new container and insert spike hang on the pole. Then, reopen clamp on tubing and adjust flow. Next is to label container according to agency policy. Indicate the time and date, hook rate, name of the patient, type of IV solution, and incorporation there is any. Discard used equipment in proper manner. Next is to perform hand hygiene. So to change IV tubing and solution, first is to gather equipment and bring to bedside. The materials needed are administration set, sterile gauze, tape or label, IV tubing, sterile dressing and antiseptic, clean disposable gloves, solution or ointment according to recommendation of agency. So for the implementation, explain procedure to the client. So magandang umaga po, ma'am. Ako po si Perlin Pabroques, isang student nurse. Pwede ko po bang malaman ang pangalan niyo?
Marie Chris Gomez.
So magandang umaga po, Miss Marcus. Ngayon po ay papalitan po natin ang IV tube niyo. Then, wash your hands to prevent passing of microorganisms. And then, wear gloves. Next is to open the administration set and remove protective covering from the infusion spike. Using sterile technique, insert into new container. Next, to close clamp on new tubing. Hang IV container on pole and squeeze drip chamber to fill at least halfway. Next is to remove a cap at the end of the tubing. Release clamp and allow fluid to move. And then, through tubing until air bubbles have disappeared. Close clamp and recap tubing, maintaining sterility of setup. Next is to loosen tape at IV insertion site. Don't clean disposable gloves and carefully remove dressing and tape. May I remove your dressing? Next is to place sterile gauze square under needle hub. Next is to place new IV tubing to flange IV site and loosen protective cup. Clamp the old IV tubing. Steady the needle hub with non-dominant hand until change is complete. Remove tubing with dominant hand using a twisting motion. Next is to open the clamp. And then, reapply sterile dressing to site according to agency protocol. May I put this? Then, regulate the IV flow according to physician's order. Next is to attach to IV tubing tape or label that states date, time, and your initials. Label container and record procedure according to agency policy. Discard used equipment in proper manner and wash hands. And for evaluation, document the procedure and client's response. Chart time, site, device use, and solution. That's all. Thank you.